It's not an easy thing
No.
to go into the medical field, but
Thankless
once people are
oftentimes,
once
right?
people are in it, though, even though it's difficult, you feel like I just can't leave. Like there's this feeling like I need to be here for sure.
Yeah.
So I definitely can relate to that, like, feeling like, well, somebody's got to do this, and I've got a talent here, and this is kind of one of the reasons I'm here to do this, and so I do definitely feel that what you said there, that is kind of a calling. It's difficult at times, and sometimes you're just like, man, I just don't know how much I can do with this anymore, but there are some difficulties in it, but I
think COVID enhanced that too, don't you think? I mean,
yeah, absolutely.
Especially with skilled nursing facilities, when we look at the way that nurses had to navigate this new minefield of COVID and the regulations and the protocols. We've seen so many people resign from their roles during this period of time. Not just the great resignation that we're seeing across the country, but specifically within nursing. Yeah. That's been a tough thing. Talk a little bit about what you saw in this space relative to COVID.
Well, there were a few things. So, number one, there was a fear, right?
Yeah.
When the pandemic first broke out, people weren't sure, if they were even going to live through it.
What
right?
is this thing?
Because we were on the front line, we were exposed to it, and we didn't know a whole lot about it. People were dying, and you lost a lot of people. They were just like, it's too much. I'm going to have to tap out. So there was that aspect. There's a when you're dealing with fear with like family members, and there's just another aspect of it as well, where people just wanted to work from home, and so they just have like less exposure and try to find other positions, and some people just got out of healthcare altogether as well. And there's another aspect where family members are just fearful as well of what's going on in the facility. And unfortunately, like when you lock down your doors, people for some reason in the world kind of assume the worst that's going on inside those doors, like, is my loved one getting care? And when they can't come in and see the care that we're giving, unfortunately, they always assume, the worst. And so, and one thing that we're horrible at in healthcare, and I'm sure we can talk about this a little bit later, is just that communication, right? We're spending our time taking care of people, and we don't spend a lot of time on the phone calling their loved ones, let them know what's going on. And so we had a lot of angry people that couldn't come in and see their loved ones, and then we weren't doing a very good job just being on the phone all the time, because we had to use our time to actually just take care of people.